all systems of the body, including skeletal, respiratory, cardiovascular, endocrine system, gastrointestinal, nervous, and reproductive system. And we will go in detail how the stress is affecting from brain, top of your head to your toes. Headaches can occur due to stress, trigger and intensity tension headaches. And again, it can also lead to depression. Chronic stress can wear you down emotionally and lead to depression. Even stress, if it is not properly understood or symptoms were properly managed, it can lead, as I told, it can lead to anxiety. Even it reaches a high level of anxiety, it goes to depression, depressive stage. Then heartburn. Sometimes people will, with the stress, may feel that after eating food, they feel there is a stomach acid, pain in the stomach, which could lead to heartburn or make it worse. Insomnia, stress makes it hard to fall asleep and stay asleep, which can lead to insomnia. And it is easier to understand always these two symptoms, heartburn and insomnia. Some people may have a problem in initiating sleep. They may not and they go to bed. And some may be having disrupted sleep within the in a sleepy normal sleep time. Their sleep is disturbed. We all experience all those things, and these are the stress factors. Rapid breathing. When you are stressed, the muscles that help you breathe tense up, which can leave you short of breath. Sometimes you may not be able to get proper breath. And weakened immune system. Long-term stress weakens your immune system defenses, leaving you more vulnerable to infections. Some people may have a cough and even a problem in breathing, and lungs issues will be there. Risk of heart attack, high blood sugar, high blood pressure, pounding heart, and stomach ache. Erectile dysfunction can also occur. Process of getting an erection. Stress can interfere with this process. Low sex drive. People with stress or chronic stress may have a low libido. They may not be able to perform the sexual life properly, and the fatigue that often comes with it can take a toll your libido. And mixed, especially in females, it can lead to mixed periods and tense muscles. Stress make muscles tense up, and chronic stress can lead to tension related to headache and backaches. So it needs to be understood properly. So what is the causes of stress and how it leads to symptoms and how it can be assessed. So in order to manage a condition in our day-to-day life, like a condition in the sense stress condition, what we need to understand what exactly is the stress. And awareness can create half of the solution. So properly understanding what are the causes of stress and what are the symptoms of stress, and how can you assess a stress or the stress test. So we'll go in detail. What is the causes of stress? Consuming stress. Like work stress, most of you may be having an experience of working in a firm or an institute, or in your academic life, you may be having different even project work or leading. It all depends upon your environment. Chronic work overload. When you are having more of a work pressure, or like every day the same intensity you need to work, then it can lead to stress. Unfair treatment in the workplace or the environment, job environment, that organization. If you are not properly treated, it can lead to stress and impossible expectations of your boss. Even understanding expectation is very important. Even sometimes the unmet expectations from a boss or from a higher authority can lead to stress. So you need to properly communicate with the organization or to the board, the higher authorities, to have a realistic expectations, like observing or hearing from your own opinion. You can also argue with the organization or the boss or the higher authorities to have a balancing expectations, or like a realistic expectations, and avoid unmet or impossible expectations. And again, unsupportive or hostile coworkers. even the coworkers are not supportive, even if they are behaving in a hostile manner, it also can lead to work stress and inadequate training in a particular area. If you are a teacher or if you are a manager or working with a group, if you are not having a proper training, how to deal, how to manage, always remember that stress is a fact and it cannot be avoided. As I told, good stress and bad stress. What you needed, you don't want a skill to solve that. You only needed a skill to manage that is stress. So you need an adequate training and lack of recognition or reward. You continuously worked in a firm or an institute and you are not getting a proper time period, in a balancing time, you are not getting a promotion, or according to your performance, you are not getting any kind of uh, inputs like honorarium, you will be stressed. Your values conflict with the boss or your coworkers. Sometimes you may be having both social and human values, or some of the values which you received from your family, you born and brought up, the way in which you are born and brought up, or from some of the again some kind of religious preoccupations. It all creates some kind of values, and sometimes you may feel conflicts in the values, and it can also lead to work stress and unpleasant work environment. Even that organization structure, timing, and all the environmental factors can be considered as work environment unpleasant if it is not able to manage, or it is not keeping you in equilibrium or balancing or in a homeostasis state, it can lead to stress. So again, lack of clear direction about priorities. If you are not getting a proper direction, what things need to be completed first and what needs to be prioritized second. So if it is not giving any kind of priority direction, you will be having stress. You will not be able to understand I can do, I can complete my work. And again, factors influencing work stress. One is a drive for success and changing work patterns, even the timing, even due to COVID or pandemic issues, again, the students as well as the faculties, they all are facing work pattern stress, like daily they are not interacting with the students in person to person, and even going to the college and experiencing that environment, all those factors are now blocked. Uh, so this can create, these lockdown issues can create changes, changing work in stress, working conditions, overwork, underwork, uncertainty in the sense again, uh, some of the some people may be having issues in their job, like whether I will be promoted or my position will be permanent, such kind of issues. Even the students also uh, thinking about the future, a kind of anxiety, whether if I am trying like this, whether I will be able to get this much of CGPA, or again it will create a problem in my performance, or whether I will be placed, and some kind of uncertainty that is very prevalent in this particular situation of COVID. And again, conflict. That is again arguments, the sense in the sense it can be personal conflict or family conflict, again institutional conflict. Institutional conflict in the sense of the organizational structure, there may be conflicts, and again responsibilities, even the responsibilities given, or the ability to handle your responsibilities in a proper way, both the in vice versa, both the things are very important. And relationships at work, how you are able to relate with the other person, even try to understand, one is very personal and other one is professional relationship. Always remember that work is an organization, your relationship with the colleagues is always only, it should be a professional relationship. You should not add anything to that. So you can sometimes, if you are adding or if you are not having a separation between a personal relationship and a professional relationship, that can cause also stress, change at work. If you are having a sudden or an unexpected change in the work, or the uh, it can cause also stress. Then common external factors like our stress that comes from the outside, as I said, external stimuluses, major life changes. It is, we do not know what is happening to us next moment. Maybe a person, one who gets into marriage, and what will be happening to him or his family or her family after the marriage, or the newborn is coming. So that is all these are life changes. As you know, life cycle changes. Even if you are taking a couple, there is a life cycle changes. If you are taking a person, again, there is a life cycle changes. So we need to understand what are the, yes, what is outside of us, outside us, external stimuluses and relationship difficulties. Even the students are having like breakups. All those things can cause stress. And financial problems is again external factors, and trauma experiences, some kind of death or a kind of any kind of abuses, verbal or physical abuses can cause a trauma, or any kind of accidents, and children, family, noise, or toxins or pollutions. All these are external factors which you don't have much control over these factors, or these are the external factors. It is coming from outside. And again, what comes from inside, internal causes of stress, feelings of anger, fear, and chronic worry. Some people may have a chronic worry. They're always thinking about tensions, worries. If they don't have worries, again they may think that I'm not getting any worries, and why I'm not having any tension. And again, anticipation. If you are not doing the things proper way, and if you are not actively not able to reschedule or schedule your activities, it can cause to anticipating the things. And negative self-talk, as I told, cognitive distortions earlier, like cognitive worries, negative self-talk also will lead to stress. Some people may, while observing them, you may feel that they're very calm and quiet. They may not be having that much of, blah blah, or making very vibrant community, but they may be very silent enough. While observing him or her from an outside or a third person's point of view, you may be able to identify that that person is very calm and quiet, but inside of him, he may be having more of a negative self-talk. So this is an important thing to understand. Most of us are having this kind of negative self-talk. Instead of speaking to someone else, or while you are working in a college, working in an institute, working in a organization, or you are being in a class, or you are having a lot of company, or your colleagues are there, but you are not talking to them. Instead of that, what you do, you talk to your own self. So that is a negative self-talk. If you are having that kind of attitude, or if you are following that kind of pattern, instead of speaking to out, you are speaking to your own self, and it always be negative, then it can cause to stress. And unrealistic expectations or perfectionism. I need to complete this thing which is with this point of time, or I need to complete this thing in this manner. That kind of obsessions or that kind of compulsions are, if you are having that kind of any kind of obsessions or compulsions, it can also cause to stress. And as I told in earlier, you need to always realistic expectations. That is very important. Unrealistic expectations always not good for personal or professional life. And rigid thinking, lack of flexibility. You may be thinking in too extreme, rigid, like a closed kind of thought pattern. You may not be able to open up to others, or your understanding or your suggestions may not be flexible, or you will not make any effort to change your thinking pattern. So that also, that inflexibility or the lack of flexibility can cause stress in our life. Or all or nothing attitude. You think in two extremes. Maybe you may be thinking very positive, and another way you may be thinking in very negative. So all or nothing attitude also is a very important cognitive error, which needs to be corrected, which needs to be normalized. So always remember that our thoughts are always linguistic, are thinking by language. So in order to correct your cognitive distortions, what you needed is to correct your language. Instead of saying negative words, don't think about positive. Be realistic. In the sense, both are different. Instead of you, if you are having more of a negative thoughts, or all or nothing, or a rigid thinking, or any kind of mind reading, some kind of, if you are searching in the internet, you will be able to understand what are the cognitive distortions. So what you need to understand, all our thoughts are linguistical. So in order to avoid negative thought pattern, you need to be realistic while changing your language. Sometimes maybe, or perhaps. These terms can create a realistic thought. Instead of using negative affirmative sentences, you add sometimes, maybe, or perhaps, or sometimes I am not good, perhaps I am not good, or maybe I am not good. So these sentences create a middle or a balancing statement. So every time whenever you are getting this kind of rigid thinking or all or nothing thinking, you need to ask to your own self that what is the evidence which support this thought. So you need to understand from your own life experiences, what is the evidence? Do I have a proper evidence to support this thought which I am performing now or which I am holding now? And again, if you are not having that, sometimes you will get exactly an evidence which support this negative kind of thought. So again, the next question should be like this: what is the evidence which doesn't support this thought? So again, you will get both the evidences which support this thought and evidences which doesn't support this thought. So again, as I told, linguistically you are changing. Sometimes like perhaps like this, or maybe. So in that way, you can practically you can change your negative thought into alternative or realistic thought, not into the positive, not into the positive. Okay, again, these are the symptoms which you find in stress, how your physical or mental and behavioral changes occurs when the stress occurs. Physical stress can cause heart disease, stroke, blood pressure, headache, migraine, colitis, diabetes, kidney disorder, allergies, asthma, ulcers, breathing problem. And then mental depression, as I told, apprehension, irritability, impatience, muddled thinking, or again cognitive distorted thought, indecisions. You are not able to take any decisions. Bad judgments. Your judgment is not adequate or it is not proper. Now always will be negativity, low mood, there based on increased smoking or any kind of substance abuses like alcohol or any other substances, loss of appetite, insomnia. Sometimes you may not be able to sleep properly, restlessness, will be not able to sit, you will not be able to properly balance your life, loss of sex drive, drinking more, all those things in detail we have seen earlier, so I am not giving a lot of time to explain all these kind of things. So what you can do is, another thing is like causes is work burnout, pessimism. You may be thinking very negative, you don't have a proper optimistic thought. Every time if you are burned out or the work stress is increased, you may feel very negativity. So one important thing is to understand how you can ventilate your emotions. That is very important. So not regulating your emotions or the work burnout is not properly managed, you have a increased dissatisfaction or inefficiency at the job, you will not be able to properly perform properly at your job, and you feel guilt, irritability, and cognitive, emotional, physical, and behavioral environment is there. So burnout, how you can manage or practice burnout? So ventilation is an important concept in psychology. So properly ventilating your emotion is important. So suppose you are having a room and you closed all the door and windows, and there is no air circulation. No, if you are not having any air circulation to the outside world, what will occur after 1 hour, 2 hour, 3 hour, even the hours when it fast, and what will happen? You will get frustrated, or you will get very discomfort way in sitting that particular room. You feel very bad, you feel problem in properly breathing, all those things will be there. So what you needed, you need to open the windows, you need to open the door, so you'll get a fresh air inside. So the same way in your mind, in your thought, whenever you are having a lot of work, hectic in work atmosphere, you need to burn out, you need to ventilate your emotions properly. So we will see how you can ventilate or how you can validate your emotions in the coming session. So even behavioral issues we have discussed. discussed, and again, cognitive factors, memory problems can also cause stress, and inability to concentrate, poor judgment, seeing only the negative, anxious or racing thoughts, and constant worrying. And emotional issues like, again, symptoms, moodiness, you will be feeling very low mood, and irritability or short temper. For a simple things, you will be outbursted, you will be verbally outbursting towards the other, or you feel very irritable, and agitation or inability to relax, very tiredness, you feel very fatigability, and feeling overwhelmed, sense of loneliness and isolation, depression and general unhappiness. These are the emotional cause, symptoms of stress. So we need to identify whether I have all these kind of symptoms, then I need to go for a help, or I need to understand that I have a stress. And physical issues that I told, you feel different pains or body pains, stomach pains, diarrhea, constipation, nausea, dizziness, or chest pain, rapid heartbeat, loss of sex drive, frequent colds. All these are physical symptoms. Behavioral, like eating more or less, sleeping. Again, these are all repetition. I separately mentioned in this slide, so I don't want to give details for each one of these. And nervous habits like nail biting, pacing, all these things are like symptoms. And what are the stress? Testing your, assessing your stress level. There are different standardized stress test or assessment tools which you can download easily from the internet, and you can assess whenever you are having a doubt according to the all these symptoms which I have mentioned, or the causes which I have told, and what all, if you are not again having a doubt whether I have a test stress level or increase the stress or not, you will be able to get lot of properly validated psychological stress. Question like questionnaires and inventories are available, scales are available. So you can just have a note out of it, and you can search in the internet, like a work stress questionnaire is available, daily stress inventory for adolescents is available on the internet, Holmes Rahel life stress inventory. That is very important thing, very effective, like it is produced by APA. Depression anxiety stress scales, that is mainly used in the clinical setting, and perceived stress scale, and social readjustment rating scale, and that is again considered as a job stress inventory. So these are some of the standardized stress. In that, that questionnaire mainly assessing how the physical stress, how much is the physical stress, how much is the biological or the emotional stress, and how much is the behavioral disturbances you are experiencing. And if somebody is interested or still having a doubt that whether I am holding a stress, like a bad stress, they can go for this kind of self-administered questionnaires or inventories, which is easily available in ResearchGate or in the internet. Google, you can download it from that. So this is very important. These are the management techniques. We all know that in our day-to-day life, from beginning to up to this time, we were experienced in different times, different type of stress. So managing techniques are very important. So in order to drive a car, you need to have a proper understanding about how the driving skill. The same way, whenever you are having a stress, you need to have a proper techniques. You need to have a proper techniques to manage your stress, not to resolve your stress, to manage your stress. Again, I am giving more priority for management, not to the resolving or not to the solution. So that is very important. So environmental, these are the like a systemic understanding. When there is the stress level is very high, you need to have an allostasis or homeostasis. And the other thing is an adaptation. As I told, adaptability and adjustability are human qualities, which is only for human. So these are the what we experience, what we explained up to now is like systemically represented here. As you know, one system is having an issue, it can affect the other. If you are having physiological issues, it can affect your behavioral issues. If you are having thought issues, it can lead to your emotional issues. So it is always connected. One system can affect the other one. So expand your stress management, mastering four strategies to avoid the stress. Second, alter the stress. Third thing is to accept it, and fourth one is to adapt. Four A's of management: avoid, alter, accept, and adapt. We'll go one by one. How you will be able to avoid your stress, and how you will be able to alter your stress, etc. We will be seeing how you can avoid. One, believe it or not, you can simply avoid a lot of stress. Plan ahead, rearrange your surroundings, and reap the benefits of a lighter load. Some people, they may not be even many of them, even many of us feel that flight response is always negative. It is not like that. Sometimes, if suppose if you are somebody is trying to attacking you directly, the best thing is to just fly away from that, avoid that situation. So that is very important management skill. It is nothing to think that if I am fly from some situations, it is my weakness. Don't think like that. So take a control of your surroundings. Control in the sense, think about even now again is an avoidance. No, when COVID is here, we are making a lot of avoidance. If somebody is coming near, close to you, you feel 2 meters of distance. And if you are feeling you are touching to some of the objects which is very uh, infectious, you will wash your hand, or you will sanitize. Or these are the avoidance which we practice in our day-to-day life. So in the same way, you need to practice in your thought, in your mind, in your brain to keep this skill, avoidance. Take control of your surroundings. Second thing is avoid people who bother you. Sometimes people, those who are, you may not be having that much of stress. You may not be having that much of anxiety. The problem is created by your colleague, your coworker, or your friend. He or she may be having stresses and anxiety. Simply ventilate his emotions like stress, anxiety, all those things come to you. Or when you are talking to him or talking to her, automatically that stress is shared or that anxiety is shared. So best thing is to avoid people who bother you and learn to say no. This is very important. This is a kind of assertive. As you know, most of us are very aware about the life skills trainings. And assertiveness is one of the best, one of the very important assertiveness training in our work life and in our academic life. Learn to say no. In the sense, when you are saying no, you need to use I statements. I statements in the sense like I feel I am not able to do this. I am thinking that I am not able to do this. According to me, like that you need to use I statements. According to me, I think, I feel, I understand. Use this kind of languages to say assertive, yes or no. So in order to be assertive, you need to be think about use the terminologies like I, and always think that I think, I feel, I according to my understanding. That kind of using I statements will give you more confidence, and it can create again assertiveness. And ditch part your list, like you need to identify what all the priorities, what needs to be prioritized first. You can you can divide your daily activities or your job responsibilities into A's, B's, and C's. You give priorities first to the A group, and second you need to give priorities to the B group, and third to the C group. Sometimes you may be having a lot of work pressure, or you may be having a lot of academic pressure. So what you can do, you can A and B stand upon the next level or tomorrow, or it can simply avoid. So that you need to dispatch your life list or work list. So this is very important to understand what is avoidance. Then the second thing is to alter. One of the most helpful things you can do during time to change your situation for better. Respectfully ask others to change their behavior. If someone is shouting at you, If someone is irritating you or someone is not giving you proper respect and value, you can respectfully ask the others to change their behavior using I statements. That is again a life skill, that is again an assertiveness in our life, which is always needed for us to create our well-being, our mental health in a proper way. So always try to respectfully ask others to change, alter their behavior. And second one is to communicate your feelings openly. I feel, I understand. According to me, like using I statements, you need to properly ventilate your emotions, your feelings towards the other. So that is very important. Suppose our mental health or our mental courage is different to different person. Suppose if you are having a glass which is having a 30 ml of water, it can contain only 30 ml, and if you are pouring 1 liter of water in that, what will be an effect? The rest of the out of 30, rest of the 7 ml will go outside. So that is very normal in our day-to-day life. The same way, whenever your mind having a strength, more than that, if that stress is occur or the stress is coming to your mind, your life, it can create stress. It can lead to both physical and mental issues. So what you can do, you can normally ventilate, normally communicate your feelings openly towards the other one who is creating or issues in your life, tensions in your life. We can, and again, manage your time better. Manage your time better in the sense you need to reschedule your activities. Suppose if you are managing a pattern, if you are managing a timetable and it is not working properly, again, you need to come back and reschedule your time, and it can change, it can alter your stress level. And again, state limits in advance. You need to say what how much is my boundary, personal space, and even working in a community, working in a department, your space, again, you need to limit your state. You need to state you sorry you need to state your limits. This much I can do, this is my boundary. I will not allow anyone to cross this. So in that way, you will, if you are able to properly alter your environment, you can manage your stress, your situations, you can manage your stress. And the third one, first one is avoidance, second one is alter, third one is accept. Sometimes we may have no choice but to accept the things. The talk with someone when you tried best to avoid, but still that stress is there and it is existing and it is again attacking you. You just talk with someone. You can share your emotions. Again, that's a kind of ventilation. You are ventilating your emotions to someone whom you can trust. Then again, forgive. That is again a human value, life value. It needs to be understood as a life value, and forgiveness, as in Indian context, we all have in our religious perspective and in our culture itself, we have that value as forgiveness is an important, very important human life skill value. So we need to understand and we need to accept and we need to forgive. That is again a value. Being a human, I need to keep some, or I need to grow in some values up to my death. So that is also an important. Try to understand forgiveness is a value. And practice positive self-talk. Practice positive self-talk in the sense you need to understand that you have both conscious and unconscious mind. Even the conscious mind is, you are aware about, now you are listening to my class or you are observing into my screen or your laptop or whatever your devices, you are looking into that. So you are concentrating, your conscious mind is aware about the talk, about the things happening now consciously, but your unconscious, that is aware about the environment where you are sitting, your room, your table, and your wall, the people around you. All those things are unconsciously coming into your brain. So again, think about out of 100, if you are taking conscious and unconscious, 30% of your conscious mind is you are aware about, and the 70% you are unaware, that is unconscious. So that unconscious mind is always controlling your conscious mind. It doesn't have any rest, it doesn't have any tiredness. Unconscious is 24 into 7 is active. And the conscious mind is just opposite. As I told, 30% you are aware about your conscious mind, and this conscious mind is tired. It is getting tired. It is always, it needs rest. And you always observe, sometimes you may be observing that, no, even the unconscious is controlling your thought. Unconscious is generating automatically your thought. So practice positive self talk, in the sense what I'm trying to say is, you are consciously, through your conscious mind, you are giving comments to your unconscious mind. For example, my name is Anish. So how I can do practice positive self talk? I need to look at my mirror, or wherever I can reflect myself. I look at that and I call my name by calling, like, for example, Anish, you are a good person. And if I am repeating, or Anish, you are able to manage your time properly. Anish, you are, for always call your name like as a third person, or as a, from outside, like, not conscious or unconscious, a third person calling Anish or your particular name. Then you use the word you can do your work properly, you can complete your assignment properly. Always first thing is to call your name by name, and second thing is to use I, or you say that you, then repeat the sentences. So this kind of positive self talk, suppose if you are having three sentences of a positive self talk, and you practice that thing for next 10 days, morning and evening, before suddenly after wake up and before going to bed, it will become part of your behavior, or it will automatically influence your conscious mind. Again, one more example I would like to suggest, I would like to clear out this particular thing is, if you are not liking any person and you started practicing smiling at a particular person for 10 times or 10 days continuously, every day when you are seeing him, really you are not liking him, but you are trying to smile at him, just try, like, like a mechanical smile, or you did it properly, proper intention. What will happen after the 10th day it is over, or the 11th or 12th, 13th day, when again you met him, automatically your mouth or your face started to smile. So that is, every behavior is learned. So what I am trying to say is, practice positive self talk, and this can influence to reduce your stress level, and learn from your mistakes. Whenever you are feeling stress, and you understood that this is a failure happened to me, this is because of my lack of management skills, this happened to me, so try to learn from mistakes. This is also a lesson which is given to me from this kind of stress. And the last thing is to adapt. Thinking you can't cope is one of the greatest stresses. That is why adapting, which often involves changing your standards or expectations, can be most helpful in dealing with the stress. Adjust your standards, practice thought stopping. That is very important. How you can adapt to the, even as I told, if you are taking a triangle, understanding it as a triangle, first thing, suppose in upward there is a thought. In the one side there you may be feeling emotion. Other side it is behavior. Every thought is creating emotion and behavior. It can lead to behavior, and it is cyclical. Thought, emotion, behavior, thought, emotion, behavior. It is always cyclical. It is moving. So what you can do is to create a practice thought stopping. Suppose earlier I said that every stress is coming into our mind, in your thought, through our senses. External stresses, external stimuluses received through our senses, reaching to our conscious mind, and it is sent back to it is going into our unconscious mind. So what we can do to practice thought stopping, in the sense how you can practice thought stopping. When you are alone in the room or nobody is around you, you can say loudly stop. When you are saying stop, automatically you are hearing that. So which sense organ you are controlling now? Your ear, you are hearing. And second is to practice thought stopping is to wear a rubber band. Suppose if you are always having stress and anxiety, or a very disturbing kind of person, you are getting a lot of thoughts automatically, repetitively, uncontrollably. So you will not be able to manage daily activities properly. So what you can do, you can practice rubber band technique. You are wearing a rubber band on your wrist, nearby your watch or nearby your bangles. So what you can do, whenever you are feeling stressed, you can just pull that rubber band and remove it. So what you will feel when you are when you are having a thought like, oh, I may not be able to complete this. This is my thought. So what is my emotion? I feel stressed. I feel anxious. So what you can do instead of to manage that one, you can remove that. You can pull out this rubber band and remove it. So while doing that, what will happen? You are getting, instead of stress and anxiety, another emotion is pain. So when you are pulling and removing your rubber band, what sense or which sense you are affecting, which sense you are trying to control? Your skin, your touch. So again, the third thing in thought stopping is to think or visualize a red signal. We call it as a red signal technique. Where you are seeing normally red signal. Red signal we used to see in traffic. When the traffic, when 2 kilometers road is, you are able to see or you are able to visualize. The driver started to run the vehicle very fast. Suppose if it is running in a or vehicle is running in 100 kilometers speed, a red signal, if you are seeing a long distance, a red signal, what the driver will start to do? He will push the brake, he will remove the accelerator, then again he will put the clutch and down the gears, and he will look at the distance between the front vehicle and the back vehicle. A lot of things he do in between. The same way he tries to limit or reduce the speed of that vehicle. It comes down 19, 18, 17, 60, 50, 40, and it reaches to the stage where there is zero. Then that red signal, the intended intention of the red signal is there. You stop. Again, after some time, again green light will occur. It is not starting 100 kilometers. You will again slowly the 50, 40. The same way. The same way, what you can do is you can again think about a red signal. So you are controlling another sense, which is your vision. So while doing so, you are again trying to control your thought. So in thought stop, three things are there. Say stop, and again you may be wondering that if I am working in an environment, working in a class, or I am sitting in a group of people, how I can say stop loudly? If I am doing it in loud voice, other people will think that what this person is having, whether he is normal or abnormal. So you can say it in your own mind. So that is very effective way whenever you are saying that. And again, rubber band also is, sometimes it is not possible to pull out rubber band every time. So instead of pulling out, you can pinch on your body anywhere you feel there is a instead of your anxiety, instead of your tension, you are getting pain. So you can practice that thought stop technique. That is also very effective. And while doing for these three things, stop, say it, stop, then again red signal and rubber band. For doing these three things, you need only 3 seconds. Within 3 seconds, you need to do that. Same way as I told, again, maybe for 10 minutes, you may be able to control your thought, creating stress, which is creating anxiety. So that is very important thing. Try to practice thought stop and reframe. You can again think in another way. Adopt a mantra. Like most of us having different slogans in our life. So try to keep mantras, which is in the sense not religious mantras. What I told is which is to be very directive, which I feel very problematic in my life. You need to take it as a mantra. I can do this in proper time, or I will keep time in a proper way. That way you can manage. Create an assets column. Like you need to think what are the strengths and weaknesses of me, and you need to adapt it and look at the big picture. Like you need to identify how what is the worst thing can happen. Always think in worst thing. What is the worst thing can, if I am not doing that, what will happen? And if it happened, what will happen? And if how much it will go to the worst. So if you are thinking in a worst manner, you will be able to understand a clear understanding about stress. And this is contraindication. As I told, there is a peer pressure, impaired social network, excessive, compulsive. All these things are there. Sometimes what the people will do, instead of managing to manage stress, they will go to some kind of uh, social media or a stressful coping mechanism, and always this can lead into some people again a pathological condition. Again, stress itself can lead to pathology in the sense psychological disorders. The same way, if a person sometimes they use some kind of coping skills, like to remove from work pressure, to be escape from social or poorly, unsafe, all those things, what they go for like accessibility. There are studies which say that even as stress is there and the person is moving towards a game online or uh, social media, it can lead to addiction. So these are the pathologies, like when stress is not properly treated or understood, it can lead to social anxiety disorder, generalized GAD, generalized anxiety disorder, and PTSD, post traumatic stress disorder, or substance abuse disorder, alcoholism or kanja or any other kind of substances. And even schizophrenia also is one of the things is that whenever you are having a chronic stress, and it can lead to schizophrenia. The person may feel delusion, false perceptions, which can false beliefs which cannot be challenged, and sometimes it can lead to problems in daily functioning, social functioning. So that's schizophrenia again considered as a great mental or the severe mental disorder, or bipolar disorder, bipolar BPAD in the sense like person sometimes he may feel very high anxiety and sometimes he may go to depression or a manic state. So these are the bipolar affective disorders. And major depressive, like a mild level of depression, major level of or moderate level of depression, severe level of depression. What are the episodic type of cause pathological stress? And how we can manage stress at work? One thing is increasing feelings of personal control and improve job related stress. 5 steps are there. Like one thing is to identify how you respond to your specific work stresses. And again, set to respond more is thinking when in conflict, negotiate, pace and balance yourself. Always remember that even cognitive distortions, as I thought, cognitive errors are there. Mind reading is one of the cognitive error. You are trying to read the mind of a boss, or the dean, or the faculty advisor, or your project guide. So some people may be like that. I have a lot of experiences in my life in as a counselor at NIT. What I feel is that most of these academy students, they feel they are trying to read the mind of the uh, guide or their advisor. So what they feel, if I go with this assignment in this way, he may think like this, or he may evaluate me like this, or she may think that I am not a good student. So this kind of distorted thoughts is always challenging, or it needs to be challenged, and it is always need to lead to stress. So change your thinking, and when in conflict, negotiate. Always remember that conflict is very normal, and having a proper healthy arguments or negotiation, healthy negotiation is very important in every conflict, and it is not bad. If you are being alone, or if you are arguing with someone, or being alone, if you are arguing with your own self or arguing with other one, always first thing to remember is having a healthy argument. That is very important. And pace and balance yourself. That is also important. Cognitive rehabilitation. Cognitive rehabilitation in the sense, keep a calendar. Don't rely on your memory to tell you when you are and where to be. Certainly for the next week or month. Always try to keep a calendar. Like for that, you will get a memory, what to do first, what to do second. Even now it is available in every mobile. You can keep a calendar. Sometimes people will think that, oh, this is very easy for me, I can manage it. But always try to point out somewhere what you need to do, so that can lead to always in positive way. Develop a system to leave items where they are visible and where you will see them until you need it. Even if a person is not having a proper memory in his work environment, he can keep items where they are visible and where you will see them until you need it. Even some people, according to their stress, even a person is having stress, it can affect the memory. So what you can do, if you are carrying your ID card there, and along with that you can keep your specs, along with that you can keep your purse, along with that you can keep your money, or the things which you need to carry for the work environment or to the college. You need to keep all those things a place where you can see they are visible and where you will see them until you need it. And complete brain challenge games. There are researchers which shows that mental exercises like word puzzles, playing strategy games, all those things can increase your coordination skill, or it's all called as brain challenge games. The purpose of performing this task is to stimulate your brain cells. When you are doing these brain challenge games, it can increase your concentration, it can increase your judgment, seeing only the negative, all those things can change it. And emotional diffusing. Write in a journal, talk with friends, family, or a counselor to let your feelings out. This is again a ventilation, as I told earlier. So I am not taking much time to explain these kind of things. Do something you enjoy like a hobby. Caring for pets, you can care for pets. Voluntarily you are working. It also will enhance yourself. For creative activity, painting or drawing, or listening to some music, or creating some videos and posting it in YouTube, like many activities which create emotional diffusing. And breathing exercises, like it can create more oxygen and release carbon dioxide in your brain cells, and all the body will get relaxed, so that you will get moodiness and irritability or short temper, agitation, inability to relax. Whenever you are doing emotional diffusing, you will be away from these kind of things. And physical interaction, exercise is very important thing which manage your stress and relieve muscle tension. Try to always remember that minimum 45 to 1 hour physical exercise is necessary for our good mental and physical health. To start off simple, a great way this can be done in is walking or house cleaning, dancing. There are different varieties of dances like Zumba and many other dances which give you more relaxation. All the same, sometimes you may be enjoying music, and along with that, doing physical exercises without any uh, tiredness. Even yoga also very important physical interaction. To relax, separate a group of muscles one by one. Yoga, JPMR is very systematic way of relaxing your muscles. That also you will be it is very easily you can practice. JPMR script is available in the internet, and there are YouTube videos how you can practice JPMR. JPMR, Jacobson Progressive Muscle Relaxation Training. Jacobson developed this progressive muscle relaxation. You are concentrating from top of your head to the toes of your leg. You are concentrating each part of your muscles, and you are relaxing it. According to brain, even you cannot concentrate at one time one thing. More than one thing you cannot concentrate. You can do many things, but your brain has a capacity to concentrate only one thing at one time. So always to control your thought is to increase the activity level. So in JPMR, while you are practicing JPMR, you will be able to get more attention and concentration. You will be able to maintain your attention for a long time. And mindfulness training also very important. I think I'm going little fast because in discussion, if you are getting some doubt about these kind of techniques, you can ask. I could explain that time. And again, behavioral issues incorporate healthy techniques to help soothe your soul and release tensions. Like, you are always consoling your own self, soothe your soul and release. Even self massaging also is very effective. And eating healthy snacks like nuts, apples, cheese, crackers, or vegetables. All those things are very behavioral changes which you can make to reduce your stress. And organic or herbal sleeping aids to help put your mind at rest. Now there are a lot of musics are available, like stress releasing music in night or sleep. All those things can be very effective, and sometimes organic and, like, smoke and voices, which all these kind of issues will reduce your behavioral interventions, will reduce your stress. And these are the simple ways to elevate stress. This can be a coping. It can be considered as a coping skill. And always try to identify laugh for the day. That is very important. This is there is a new emerging trend in the psychology which is called positive psychology. In that, mainly one important thing which you need to understand is happiness is to be created. That is an important thing. It will not come normally. It will not come automatically. Which needs to be created. So laugh for the day. This is very some of the social activities which I did. Prank. Lot of prank videos are available. And activity rescheduling. You need to reschedule your activities from morning to the evening, and even social interactions like Instagram, Clubhouse, Facebook, Snapchat, or comedy with Kabil, or many comedy series are available. So you can call all those things, which is very effective to reduce your stress. And again, getting help for stress, even dangerous, if you are feeling that your stress level is very dangerous, threatening to your physical, emotional, and mental health, then you should go for a professional help. You do not have to face stress alone. That is very important. You need to search someone very professional to give you a proper insight about your stress and management skill, and that is very important. Some emergency symptoms to watch out requires interventions, like you need to restore the balance by reducing the stresses or increasing your ability to cope, or both. So
Sir,
and these
you're
are
muted.
I'm muted.
No, no. Now we can hear you. In between, we were not able to hear you.
Oh, okay,
Now it's fine.
okay, 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 okay. And this is we are ending into the last point, that is the emergency symptoms. If you are having, you need a treatment, like in a clinical intervention is needed when you are having suicidal thoughts, not ideation. We all feel some kind of suicidal. Then uh, idea is different, thought is different. And second one is compulsive drug or alcohol abuse. That also will lead to an emergency symptoms, which is a cause of stress. An abnormal social withdrawal and isolation. The person is withdrawing from the social environment and he is isolated by himself and not or herself, not interested, lack of interest in pleasurable activities, or he is not able to get any pleasure while interacting with others, or physical violent outbursts. If the person is outbursting physically, then that is again an emergency symptoms which needs treatment. Uncontrollable crying or emotional outburst, always spells and panic attacks. Some may be having panic attacks. Always chest pain, again that is also a symptoms. So you need to again getting help for stress for your physical, emotional, and mental health. And you do not have face-to-face stress alone. I said earlier. One second. And this is a final thing which you can practice a stress journal. A stress journal can help you identify the regular stresses in your life and the way you deal with them. Each time you feel stressed, keep a track of it in your journal or use a stress tracker on your phone. Keeping a daily log will enable you to see patterns and common themes. Write down what caused your stress, how you felt both physically and emotionally, and how you acted in response, or what you did to make yourself feel better. And these are the things, like you can like make a columns like date and time. And second thing can be a negative thoughts which is generating stress. So you can make it as a column like a negative thought. The third one is like you can have an emotions which is causing stress. So you can use that kind of ABC analysis. What activated the stress? During the stress, what was my behavior and how that stress is automatically gone. So in that way, you can assess or you can create a stress journal if you are feeling that my stress level is very high. So that can, so this is a thing in general. I think not comprehensive, mainly concentrated on academic perspective, or like a work as a student or as a faculty, how you can manage your stress level. And now I would like to open this session for uh, uh, doubt and clarifications. If someone is needed anything, you can ask regarding these things from any point of view. If I am able to answer, I will do it.
Yes, sir. No, sir. Actually, the forum is open. The participants can directly interact. I hope instead of putting up in the chat box, I felt I may not be able to exactly convey your fields to the expert. So I may ask you people to directly interact with the expert. Thank you.
Yeah, good afternoon, everyone. I'm Namita, and I have one query actually.
Yes.
My daughter is telling that she is having depression issue, but I don't feel that. Maybe I'm wrong. So how can I help her? I just want to know about that.
The same
Maybe
way you can ask her.
Maybe due to this
Yes.
COVID condition, and the other reason maybe that we are just shifting our location after 2 to 3 years every time. So it may be the reason that she is telling me, complaining this thing. So how can I help her?
Okay, the thing which we can do is to understand what exactly making her, what are her thought patterns. Even the thought patterns are creating stress. So we need to ask her, or we need to have a proper eliciting her emotions. What is negative to her? Negative emotions. Hello?
Okay, yeah.
We are able to listen, no? Hearing. Okay.
Yeah, I
Yes,
can.
yes.
Yeah, we need to identify exactly what is going on in her mind, thought patterns. Maybe he can verbalize or she can verbalize in one or two words, like I feel I'm not getting calmness in my mind. Or he may be able to tell that it is because of environment, or maybe any other kind of stress. We can directly elicit that kind of issues. And
the actual thing is that in this adolescent age, they are not happy to share with the parents. That's the thing. Where is this is the problem actually.
Yes, ma'am. That is also there. And in that case, what we can do is suddenly we can take her to a counselor in a basic even that the stress level. If you are feeling that not that much severe, then you can take her to a counselor and they can easily guide her. So that is a very important thing.
So is it possible for you to share any number or any to whom I can contact?
Basically, from which part of the country?
Basically, I am from Rajasthan, but currently in Myanmar.
Okay. And a lot of NGOs are providing free counseling in this COVID season, so that online counseling is available. In the online platforms are available. I think again, if you are, you can search in the internet and you can find it out. And if you are not able to have it, you can directly contact me. I can guide you to some of the proper counseling, groups, like persons, those who are with RCA registration.
Frankly speaking, I don't want to go for trial and error method. I just want to go at the once, so that it will be helpful for her as soon as possible.
Rehabilitation Council of India is accepted. Even a registered clinical psychologist list is available in the internet. So you can go for a Rehabilitation Council of India site. From that, you can search somebody from the Rajasthan. Then you can opt for the very nearby one. You can contact them directly. The phone number, their full address is available on the Rehabilitation Council of India RCI website. And again, if you are not able to one, you can directly contact.
Okay, thank you.
Hello, sir.
Yes, ma'am.
My name is Ashwini. To what Madam asked, I would like to add a question to it.
So, how do we convince a person to take a counseling without pressuring them too much? If we find they have some symptoms of depression, in that case, how do we convince them to take a counseling? Usually, when we talk about the counseling, they just back out. So, in that case,
Yes.
what is the right way to do it?
A very good question. That because even depressive people, they are not able to take any initiatives. That is one of the most basic or the primary symptoms of depression. They are feeling always down on the stage, always feeling low mood, no initiation for anything. So in that case, what you can do is to properly give advice or properly educate the bystanders or the caregivers to take the particular person for a counseling. And if the person is a little bit, even there are grades in depression, mild level, moderate level, severe level. Even if a person is in the mild level of depression or moderate level of depression, he can be easily convinced by anyone because his thought process is normal, his insight is also is good, and sometimes his judgment also is proper. So intelligence also will be functioning properly. So in that case, a person can easily communicate, easily giving him or giving her a proper psychoeducation about the depression. What is the depression? What are the symptoms? And if you are feeling this kind of symptoms, you need to go for a treatment. And the treatment always give you a assurance that you will be automatically free from this condition. That kind of insight we need to generate on that particular person. Then only he or she will take initiative to go for a counseling. And even the condition is very severe, the person will not get insight. So in that condition, what we can do, we can take the person directly to the hospital or to the psychiatrist, start medication when that person is in a normal stage, getting an insight whether I am having an illness and I need to go for a counseling. Then we can take him to a, first we need in that condition biological intervention. I mean pharmacotherapy. Second intervention is psychotherapy. Even in depression, if it is a severe condition, or mere counseling will not work. There is psychotherapy. When psychotherapies are available, like a cognitive behavior therapy, which is, so in that case, the bystanders or the caregivers or the person one who is responsible for this particular individual needs to take initiatives to take a person to the counselor, take a person to the hospital or to the professional. So that is the practical way in which we can manage such a person.
Thank you, sir. Thank you. Can I ask one more question related to this? Yeah.
Yeah, sure.
Actually, sir, how can we manage anxiety attacks or a sense of urgency? How can we deal with it?
The thing is, for a person, first we need to identify how much severe is the anxiety, whether the person is having a simple mere anxiety or whether the person is having a generalized anxiety disorder. So proper understanding or proper assessment of a person is very important. Whether he is having his anxiety is normal or whether it is a simple tension or it is a pathological condition. Even if it is a pathological condition or it is a disorder, then we need to give a proper intervention. In the sense, anxiety needs to be analyzed or properly addressed. There are a lot of scales available to assess the anxiety. Hamilton anxiety scale is there. You can go for that one. And even the one thing which we addressed here, as I told, no, for assessing stress test is there, DAS, DASS. That also is very effective to assess the anxiety. And anxiety is always a learned behavior. Maybe from his family or her family, her parents or his parents are one of them, maybe both, or sometimes one of them. So from the childhood onwards, this particular person is learned from his parents how that anxiety pattern, that pattern of doing things in that way. So in that way, we need to relearn the person, or we need to try to help the person to relearn what he has learned or unlearn what he has learned. So proper investigation is needed in the sense case history is to be assessed like from childhood to up to now. What are the experiences which he or she received from his environment? That needs to be assessed properly. Then after that cases intake of a case history, then we need to go for a assessing psychological test. So always, even if that anxiety level is not functional or that is detrimental to our daily functioning, social life, then the person needs to be taken care and needs to be taken to a professional for it. In that way only we can manage if it is a pathological anxiety. Otherwise, again, try to relearn whatever you have done. As I told, thought stop technique will work. Say stop. Second thing is to use rubber band. And third thing is try to imagine red signal. So you are controlling your five senses so that you will be able to manage this anxiety level. That is a simple technique which you can manage. Otherwise, you can again, this as I said, stress journal. You can go for an anxiety journal. Write it down in 3 columns. You can write it down. One is time and date. Then second one is the anxious thoughts. You will be able to write it down, the anxious thought. And the third one is emotions. Whether the person is getting primarily anxiety as an emotion or the primary emotion is always fear or any other emotion, then secondary is anxiety. That also needs to be identified. Psychology, what we do is merely playing with the thought, emotions, and behavior. And this is again related with our brain.
Thank you so much. Thank you.
Welcome.
Any other questions?
Sir, one more question. Sir,
Yeah.
actually, if a person has undergone a depression stage for 2-3 months, and he has taken some medication, he has that stage, whether continue that medication throughout the life, or is there any chance for getting depression again? You have to manage those people.
Okay, it's a good question to understand a depressive condition. There are conditions in which there are different episodic depressions, recurrent episodes are recurrent depression is there. Like depression is occurring for 3 or 6 months, and it will be away from for a long years, maybe for 3 years. No depression is there. Then again, depression will come after 6 years or again 12 years. Again, we need to understand that medication is always useful to keep a balance in our neurotransmitters level. Always an integrated approach of treatment is suggestible. In the sense, the biopsychosocial model of treatment is needed. When you are like in India, especially in NIMHANS, you will get NIMHANS is National Institute of Mental Health and Neurosciences at Bangalore. These national institutes, they are providing this biopsychosocial model of treatment because they have a different group of people are treating a particular person, a group of experts. There will be psychiatrists, there will be clinical psychologists, there will be a psychiatric social worker, there will be a rehabilitation psychologist, and they jointly plan a treatment plan for a particular person, and they give personal interventions, psychological intervention, social interventions, and biological interventions. Even in private hospitals or in some other institutes, when you are reaching to them, they may be concentrating only on these biological factors, giving medication, and the person is consuming it. And even depression also, remember that if you are taking medication without taking, within 2 months, it will reduce or it will go normally. Normally in the sense, most of the cases. So again, what we needed along with the medication, we need psychotherapies, we need social interventions, we need a remedial training or a rehabilitational training for this particular person. Again, stress will come. We do not know exactly what will happen to our environment. Maybe after 5 years, maybe after 6 months, again, the same environment may occur. The environment in which the person is not able to manage the pressure So it can lead to stress, and stress can increase the anxiety, and anxiety will lead to depression. So what we can do is giving him a proper training, how to manage the stress, how to cope with the anxiety, or how to cope with the depression. So in that case, what we can do is to always lead a person in a controlled setting. We all know that curd we use for a food as a food item. We use curd, if you are eating chawal or roti, you can use curd. But once you open the big box of curd and you kept in your table, you may be able to do it. And next 3 times or 2 times, or next day it will be becoming taste will be different, and you feel very difficult to use it. The same once you used it and you kept for minus or the temperature which is mentioned there in a freezer, you will be able to use up to the expiry date, maybe 4 days without any. The same way, the person also needs to be taken care. The environment, a controlled setting. If you are taking him properly, he will not having an episode of depression. If the person is not giving a proper training, and if he is not developing any coping skills, and if he is not doing any homework which is given by the experts, then he can again, chances are there to continue his depressive episodes. And again, normally there's a saying is that once a patient is always a patient. And again, we all have a tendency, we all have a possibilities, 50% of possibilities. At any point of time in our life, we can be either depressed or anxious or stressed, and it is normal. And again, try to understand that environment and controlled setting is very important to a person to again into that depressive stage. Okay, thank you, ma'am.
One more question: is depression is the genetic or no?
Yeah, we can say that the family history is available. There is a possibility.
Sorry, I'm not able to hear you. No, it's
okay. Maybe because of my audio, sometimes my network issue is here. So what I am trying to say is that genetical factors, also hereditary factors, is an important it can lead to a vulnerable condition. If a family history, significant history of family history of psychiatric illness in the family, that can also having an impact on a particular person. Doesn't mean that all the depressions are from genetical or from a hereditary factor. It need not be. It is again a neurotic illness, not a psychotic. So we all have, suppose if you are getting an accident, or if you are losing something unexpectedly, everybody will get a depression. So it need not be. It need not be always genetical.
Actually, my mother-in-law was having this problem earlier, and now she is taking one pill. I don't know. I'm not aware about that pill. And after that, my sister-in-law is also facing the same issue. Now it's from in case of my daughter. That's why I'm thinking: is it the case or no?
Yeah, there is in that case there is a vulnerability is very high. So again, a person is getting that stage is compared with other person is very high.
Okay, thank you.
So if there is no doubts from the participants, actually there are few questions been there in the chat. Actually, maybe I will read one by one, sir. Sir?
Okay, sure.
This is from Anand Prakash Tiveri. How to manage a child of age 12 years who is very aggressive?
Okay. Age of, is it a boy child or a girl child? Can I get the information?
Anand Prakash? Anand, yeah, boy child. Sir, boy
Okay.
child.
Okay. The main issue is what are the symptoms? Which shows what type of symptoms the child is showing?
Anand Prakash, it is better for you to communicate directly
Or is
if
there
your audio is
available?
not having an issue. Yeah, Anand is available. Okay, fine. If you're having any audio issues, you can put in the chat box. We will communicate.
And even again in child cases, what from my experiences, last 80 years I was working with the child. So as a clinician, what I felt is that even more of a systemic approach is needed while dealing with the issues of the child, because when the family is having any kind of stresses, even both the parents, if the one of the parents or any siblings, if they are facing any kind of stresses, that will directly copy to a child which is below 13 years of age, because the child is not verbalized properly, even according to the Piaget stages of development. The verbalization, properly verbalizing the emotions occurs a person's life after 13 years of age. So before that, the person will be, or the child will be explicitly behaving in conduct disorders, like he or she may be having, even childhood also, internalizing disorders are there, like anxiety is there in the child, sometimes depression also in the child, conduct problems, hyperactivity, all those things can be, it is known as grouped as an internalizing disorders in the child. So we need to identify, some of the um, basic issues out of what are the really whether the child is curious about watching films or other things, or whether the child is not having a proper engagement, child is not properly caring, or the child is not getting enough attention. Because of that, the child has changed to watch films or whatever online. Maybe from the childhood onwards, the parents might have an exposure to the child to these devices. The child find only that devices is giving him happiness, or any other no other coping skills. When it is a boy child, he needs to be entertained, or he needs to given more time for an outdoor games, so that he may get more ventilation of his emotions.
Okay, sir. There's an add-on question.
Yes,
Kindly
sure.
suggest any technique to stop the curiosity of watching films and soaps, particularly during this COVID situation. That is
Yeah,
again for kids.
one thing we can do is that maintain a gadget free time, like screen time. You will be able to give a child with a proper discussion with the child, arguments with the child. You need to reach a terms with the child, terms of conditions. You will be agreeing with the child that you will be allowed to keep your phone or laptop or your TV for a for up to this time. You are having 24 hours. Within that time, you need to do for this, you need to do for that. Like that, you need to reschedule the activity of the child, and you will be able to give the child 2 hours as a screen time. So first thing you can do is to create a screen time for the child, so that the child may be able to understand that this is the only time where I can use this particular device or this particular thing. So like that, every time for the children, what they needed is to engage them in every time. They don't want to sit alone, or they do not know how to be calm. So best thing is to give them a proper activity schedule, so they will get an idea to manage each moment. And try to always remember that the screen time, even before the children, don't use the mobile. Even family also keep a rule of mobile. They don't use the mobile in front of the child, or they don't use this TV, all those things in front of the child. The children will learn whatever we are doing. So for the child, we should be a model, and you are telling to the child, don't do that, don't do this. And in front of the child, if you are watching a cartoon or if you are watching a comedy, if you are listening to, or if you are doing that one, the child is observing you. The child does not know what is correct or what is wrong. So that can be done.
Okay. So there's a question from Akansha, but I don't know how far I could able to represent properly.
Okay.
If Akansha, you are there, you can communicate directly.
That is on last question. I am facing a great problem of spending quality time with the child. That one.
No. In between, it's been communicated at 12:51. In between.
12:51. I will. At times people around you say parents.
So am I audible?
Yeah.
Yes.
So I want to ask that people, maybe parents or professors, they expect great things from you. I mean, be it terms of any competitive exam or any sort of work. And moreover, they want that work to be done in their way. At times, you may not feel that it is right. I mean, you want things to be done in your way. You have your own way of thinking of doing that work. Then how to deal such thing? I mean, you can't say them, because if you're looking from their end, you will feel that okay, they are right, but at your end you will feel like it is not right. Then how to tackle this?
Yeah, even especially from in India, what we feel is that we all have a nuclear family concept is there, and since you are being maybe parents and children are there, like nuclear family. While in a structural way we are very nuclear, but in every country, in our culture there is a joint family system is there. Each one involves in other person's life, and there is no proper boundaries available in any family. I don't know exactly. In Kerala we don't have. I'm from Kerala, and there is actually the so-called joint family system is not there in structure, but in their they always follow that joint family system for any kind of initiations or any kind of decision making. All the family members from paternal family and maternal family, all the family members involving into. So what we can think or the management way, the best way to manage is try to have a proper boundary understanding within the family setting. Even for the child also, there is a individual space is needed, and then again couple space is needed, then again sibling space is needed, then the family space. So in that way, properly the family life skills changes, or the family life skill training is needed to that particular family. Especially the parents, if they always consider their children as children up to, even if the person is at 50 or 60 years of age. For the mother, a child is always a child, and for the father, otherwise they consciously they may be accepting that you are a older, or you are having this much of qualities, or you have gained this much, but unconsciously in their mind automatically it is coming that it is you, or he or she is my child. So they always give that kind of suggestions, and sometimes it may not be acceptable for you, or you may not be able to receive it in a proper way. It is creating stress. So what at that time, what you can do, you can use assertiveness. You can tell them I statements, respecting them, valuing them, using your emotions, ventilate them primary emotions while you are saying like this, I feel like that. So this way of communication is needed, and try to understand them. Sometimes if it is not possible, opt for another option. I think this is only the way which in generally I can say, but if it is a particular family, then we need to go for in depth and understand. We cannot say that this technique will work out in the particular family. There is nothing like that. Maybe you may be seeing these kind of issues, but their primary concern may be something different, which is very hidden, and they are not be projecting it. Always, most of the people, their primary emotion is always hidden. They will not explicitly or express it, that primary emotion. Instead of primary emotion, they come with an anxious thought or anxiety or anger outburst. That is secondary. So we need to try to understand what is the primary emotion which is making them worry, or which is primary emotion which got hurted? I think this much is only I can give an explanation for that question. Thank you.
There is one more question from Amudam. I am facing a great problem of spending a quality time with children. My pressure is mounting because of this.
Okay. Then what we can do is that to fix a time for a quality time. You need to think about a quality time in the sense today, every day, like it should be a fixed time. Every day, evening 9 to 9:30 or 1 hour, or 9 to 10 o'clock, I will be fully dedicated. I am giving my 1 hour time for my child. And at that time, you will not be engaged into any other activities, not attending any phone call, not talking to anyone, only fully engaged into child, so that you are giving your 1 hour of your life, your 1 hour of your time to the child. So the child also will get an enmeshed relation or an attachment or a kind of bonding will occur. So that is also very important thing. And always try to be expressive before the child. In two way you can spend quality time. When you are if it is between your partners, you can have a more of an explanatory nature. But if it is related with the children, always expressive modality will work better. For example, when you are saying to a child, I love you or I am loving you, you need to express it. If you are buying an ice cream for the child, if you are buying a toy for the child, you are taking the child to a park and making him travel somewhere, the child easily suddenly understand that my father is loving me. And if you are trying to explain to the child that I am loving you or I am liking you, it's very difficult. Child may not be able to understand your words, your sentences, your articulation, your construction of the way in which you are speaking. The child may not be able to understand. So better thing is to be more expressive with the child, so the child can experience your bonding, your love, your affection.
Yes, sir. I hope no more questions are there from participants. If you're having any questions, please put forward. Okay, fine. Ashwati ma'am, shall we end it?
Yes, Sananda.
Yeah. So, thank you very much for the very informative session. Really, you have taken us to a different world in knowing ourselves, getting values among the family members, interaction, communication, how to communicate, what to communicate, when to communicate, all such things. I hope it has helped the participants and even the organizing committee a lot. On behalf of the Department of Civil Engineering Organizing Committee and everyone, participants, I thank you very much for your such a wonderful informative session. And if possible, actually kindly share your slides. Maybe the edited form is also fine, whatever you can share with the participants, because it's a request from many of the participants and there are many compliments to you from the participant side. I'm not reading all those things. Yes, sir. With that, I end up. Thank you, sir. Thank you very much.
Thank you so much, sir. I'm also very thankful to the Anand Singh sir and George sir for giving me this great opportunity for delivering a talk like this. And I'm very grateful to you, and especially thanking all of the participants very patiently listening to me and interestingly asking questions. Really grateful to the NAT as well as to this initiative. I'm thanking everyone. And of course, I will be able to share all these PPTs along with some of the materials, which is very easily accessible and it's very easily able to understand. And I will share with that with Singh sir, and he or they will be able to share with you.
Yeah, sure, sir. We will share. Yeah.
Thank you so much.
Thank you, sir. Thank you very much.
Thank you so much.
Shall we head for lunch or are there some instructions to be given?
Yeah, we are having some instructions. Just wait for a minute.
Sure, sir.
Ashwati ma'am,
Yes.
are you going to give the instructions or regarding
I'll just
afternoon
make one
exam?
comment and then after that you
Yeah.
can just go ahead. So regarding your feedback forms, so we have already shared it in the Google Classroom, and as well as I have also shared that in the WhatsApp group for those who can't access the Google Classroom. And even with your exam also, like maybe at 2:30, we may even try to share the link through the WhatsApp group in case if somebody is having any difficulty in logging into the Google Classroom, and if they don't need their like grades to be non-personally.
So, ma'am, timing?
Ananta.
Yeah,
Timing
no,
of the
exam
exam
timing.
will be from 2:30 to 3:30. So you'll be having hardly 20 to 25 questions in the quiz. It will be all objective type questions, like all the general questions. Like it's not like we are going very deep into the presentations. Yes, you can see the exam. Maybe you will get your feedback after you submit the form, so you can see the answers as well. So you can know your grades after that. That is why, like particularly, we have done it through the Google Classroom. So you need to score minimum 60% of marks in your exam, and there will not be any negative marking. So we have planned it in such a way that it will be all objective questions, which you can answer hardly in a minute. And I hope all of you are well prepared to write the exam. Don't worry too much about the exam. It's all just the basic things. If you have just listened to the all the lectures, you can very easily answer all those. It's all very general questions. So please join back on time at 2:30. The exam will start exactly at 2:30 and it will end at 3:30 p.m.
Yes. Any more doubts or?
If you have any more doubts, please ask now.
We can directly get into Google Classroom at 2:30, or we have to connect to WebEx?
No, you can directly get in through the classroom, to the Google
Okay.
Classroom, and you can take the quiz.
Thank you.
The closing session will be on WebEx, right? After 3:30?
Yes. After 3:30, we'll again meet in this same platform.
Yeah. Okay. Thank you.
Hello.
Yeah. Yes.
Yes, sir.
Sir, that Google Classroom link will be shared by you, no?
Already we have shared the key, right?
Because
You can join the classroom.
I am
So are you
actually,
facing
ma'am,
any difficulty in joining the classroom?
I'm not there in the classroom, ma'am.
1 minute, ma'am. I will share the key again in the WebEx.
Okay.
Yeah. 1 minute.
Okay, ma'am. Thank you.
No. Just wait.
Just wait. So in the chat box, we'll share the key again for the Google Classroom. So using that key, you can just log in. And we'll also try to share all the materials in the Google Classroom in case like there were like some people who have missed the mails or something. So we'll also upload all the materials in the Google Classroom, which you can access.
We have just shared. Kindly look into Avinesh Prasad, right? Yeah, if I'm not reading wrong.
Is there any more questions?
This is Suresh from time on the examination, ma'am. 2:30 to 3:30, like that.
It is from 2:30 to 3:30, but only one submission, only one attempt will be allowed. So you can take up the quiz anytime between 2:30 to 3:30, but only one submission is allowed. Once if you submit it, then it will be closed.
Madam, one question from one side.
Yes, sir.
Where it will be the link posted for the examination?
Yeah, same like the feedback form link. We'll be posting the exam in the Google Classroom.
So we can make that link from this platform?
No, you have to go to the Google Classroom. From there, you can access the link for the exam. It will be that Google form will be uploaded in your Google Classroom.
Actually, today when I send the feedback, then only click the link which is posted here, and I directly go to the Google Classroom through my Gmail ID.
Yeah, so now for the exam, we'll not be like sharing you the link in the WebEx platform. Instead, you have to directly go to your Google Classroom and you have to access it.
That is the main problem, because today I'm suffering from the Google Classroom, and I couldn't get touched with Google Classroom.
Okay, you are not able to join the classroom.
Right. So it is request for you, if you paste the link in WhatsApp group, then I can go for the Google Classroom directly.
Okay, we'll try to do that. So at 2:30, we'll try to give you that link for the exam even in the WhatsApp group as well.
That's better. Thank you, madam.
Okay.
Thank you.
Okay. But in that case, sometimes you can see your responses, but maybe your total grade or something, you cannot get it. I hope it won't be an issue for you. And in case if anybody wants to know their individual grades, they can email personally.
That I can collect from the email also, if you email personally.
The thing is that we only on request will be giving your grades. Otherwise, we'll not be circulating your marks through the mail. Sorry, ma'am, you are not audible.
I feel so overwhelmed when I start talking about the kind of variations that we see, in every aspect. Even if it comes to season, it comes to biodiversity, or sharing 7,000 kilometers.
No, this is I'm actually attending one webinar parallelly.
Oh, okay.
Madam, what was your concern about the private mail? Are you able to send
No, the thing is that we'll not be publishing the marks in the group.
Okay.
Yeah.
Okay, that I understand. Yes. Yes, thank you.
Okay. And in case of any attendance query, only if you have any genuine concern, like you please try to contact us personally and avoid just responding in the WhatsApp group, because it's very difficult for us, like if everyone is responding through the WhatsApp group. So we have taken the attendance directly from the WebEx, and all those who had attended at least more than 50%, 40 to 50% of the time for a session, we had considered for the attendance. Any more queries? Nanda, can we want them?
Yeah. There is no more doubts, right? Exactly at 2:30, we will be sharing the exam link in WhatsApp group, right, ma'am? Not before.
Yes.
Yeah.
No, exactly at 2:30.
Exactly at 2:30. Fine. Those who can't able to enter directly into the Google Classroom, you can use that link. Anyway.
And in case of any sort of network issue, please kindly let us know in advance. Please don't tell that after 3:30 that you are having a network issue and you are not able to write the exam. If you're having any issue, please let us know at that moment itself. Sir, if you can share your number here, we'll add you to the WhatsApp group, sir. Mallikarjuna Rao, sir. Or you can email to us personally so that we'll add you in the WhatsApp group.
Fine, we will end up the section now.
Yeah, we can.
There is one contact number, just I will try.
The other participants, if you are not having any questions, you can leave.
Mallikarjuna Rao, I have already mailed you the invitation once in the WhatsApp group.
Sir, I didn't get WhatsApp group, sir.
No, I messaged you personally the invitation.
No, sir, I didn't get anything. Hey, Daddy.
It's been sent on 30th, 2:54 p.m.
1 minute, sir.
on WhatsApp.
No, sir. Really, I didn't get, sir.
No, sir.
I'm sending
The
again,
WhatsApp
check it.
invitation was sent to you. So please check it once again, sir. The WhatsApp invitation, you have to accept it.
Madam, I have seen, I didn't get any invitation from you.
No, at present you check again.
Yeah, the other participants can leave. The others can leave and please join back exactly at 2:30.
Sir, that invitation came like expired.
Okay, I will send again.
Okay. Yes, now I got it, sir.
Yeah.
Thank you very much.
Thank you.
Ananda, can we end the session?
Yeah, 1 minute, ma'am. 1 minute. I will end up.
Yeah, okay.
Okay. Recording is going. Stop.